I was asked by Michelle to introduce Dr. Yaron Seidman. And I contacted him several months ago because I was interested in him coming up to teach a CEU class here in Georgia. I knew that he had recently moved to Florida, so thought it's not too inconvenient to bring him up here. And kind of funny story, like it's a long time ago. I can't remember exactly when I first took a class with Huron, but it was maybe 15 years ago, 13 years ago, something like that, quite a bit of time ago. It was in Austin, Texas, and I studied Chinese medicine there. And there was a symposium. He was speaking. Even back then, I was very into women's health and fertility. My friend Jeff Shelton and Jeff is here in the area. And, at some point in the class, I think Yaron kind of pause things and say, okay, I'm cooking up this brew. It's futsa. I don't remember if it was 100 grams or 120 grams, but all right, here, if you want to taste it. And Jeff and I tasted, and no one exploded. And it was, Yaron proved futsa is very safe. And, so it's a long time ago. And for those of you who don't know about Yaron's work, he's been exclusively doing fertility for I don't know how many years. He'll tell you more in person or a little bit later. But he kind of uniquely brings a fusion of Shanghan Lun theory with Huoshen Pai, with fire spirit school. He kind of melds that together. He's a longtime student of Qigong and Taiji, and he lived in China for several years. So, he's done, translations of various things, including I've seen things out. He's done translations of Confucius or Confuzi. I finished the program in 2004, the master's program, and I think Yaron was teaching a lot at that time. I hadn't seen courses offered since COVID by Yaron, but so I don't know how familiar the younger generation of practitioners is today. But I think many people who study fertility here in the United States or in Europe, they would have heard of Sharon Weizenbaum. And, whenever Sharon is doing a class and you see her, it's like a 6-stage Shanghan Lun rotating circle thing. That's from Yaron. And, I've in classes that I've sat in virtually, she gives credit to that. I've always wanted to take classes with him and kind of see, where the source is. I've always been fascinated with Shanghan Lun and Jingui. I'm grateful that he is relocated to Florida and close, and he agreed to do this class for us here in Georgia. So yeah, Michelle, I don't know if that was the right thing to say. That's what's in my head. So
That was
hopefully it's
perfect.
good. Okay.
Thank you.
Yeah.
And thank you, Yaron.
Sure. Thanks for having me, of course. Well, should I respond to that? It was beautiful. Thank you so much. Very flattering. I want to say though, in the last few years, I not only see infertility, I have other patients, difficult cases, cancer, and all kind of things like that. But for about 20 years, I would see only infertility. So, but the patient that I saw just before this session, and I finished with her 15 minutes ago, was an infertility patient. And I was talking to her about many different things, which I normally do, and one of them was mentioning the thing in Austin that you mentioned. How I was talking to one IVF doctor that I think many people know. We were talking, he wrote forward to one of my fertility books. And I was talking to her, and I just thought it's a great coincidence that you mentioned that thing. I didn't speak about Austin, that event, for years. And I just spoke about it 20 minutes ago. So there's some karma here. Yeah, thank you for having me. I'm happy to share whatever I can. Since I mentioned that patient, maybe I'll just say a few words about her because it's fertility and it's related to the topic. She's like a 33-year-old young patient. She's like at her prime, and she started to go through the fertility clinics, and first she's just doing IUIs with medication, but there's already started the talk that since it's not working, if this cycle would not work next month, let's start talking about IVF. There's a certain trajectory that most people are being pushed through. And that bothers me because I've been doing it for so many years and she's so young and she can get pregnant on her own, no problem, unless she's being pushed through that route and maybe she'll get me in more trouble than rather getting pregnant. So I'm like, very passionately talking about her. And today she started to do herbs. She said she kind of changed course to do herbal medicine after talking to her. And it was very passionate about the conversation about how a young woman should actually be able to get pregnant on her own if she gets stronger, if she gets happier, if she gets healthier. Like this is the thing that we're doing, in Chinese medicine. But how to get healthier, how to get happier, right? There's a vast body of knowledge here. It's not just a plain statement. And so like what's hiding behind that tip of the iceberg, it makes all the difference in the world. So hopefully in the seminar we can kind of unpeel that thing, like what's that iceberg, and go more and more into that. But this patient that I just spoke to, like literally up to 15 minutes ago, was a very good conversation. Austin, Texas came as part of the conversation, but it's totally the topic of what we want to learn in the seminar. Yeah. I was just thinking, maybe just to conclude that thought. Yesterday I had someone that came to me, he's working on my car, and he had terrible back pain and stuff, like horrible. And he came here for some acupuncture, and I put him on I have some intelligent massage bed and some other stuff in the center in the new place. I thought about it's like helping people. Like helping. He has back pain, I helped him. But this patient that just came, the fertility patient, that wasn't help. This was like saving. Like this person needed to be saved. Like she can go into a very, very bad trajectory, and if she will get pregnant at all, the kids will maybe not come as healthy as they should come out. This is talking about saving lives. So I just wanted to set this difference between helping people and saving people. And a lot of time in fertility patients, for us, for what we're doing, is actually saving people, not helping. So I wanted to wrap up that.
Thank you. Thank you so much for sharing those examples and your thoughts on what really encompasses fertility medicine for you. Can you, just for people who may not know, can you speak on what the Hunyuan medicine is all about and what fertility treatments look like in your practice and what you want to bring to the seminar?
So Hunyuan medicine, which is like the name that I gave it, originally the name comes from the Tai Chi that I learned, Hunyuan Tai Chi with Master Feng Zhiqiang. So this is very famous, Hunyuan Tai Chi, Hunyuan Qigong. I studied with him many years. I got the name from there. But the medicine part, I got into Shanghanlun medicine, and like Mark mentioned, the fire spirit, which is a branch of Shanghanlun type medicine. And I was fascinated by it. I got deeper and deeper into it, translated some of the works by Zheng Qing'an, the founder of the fire spirit. And this is a very big topic, and we can get into it in the seminar a little bit, but I'm just sharing what Hunyuan is. So Hunyuan is like my exploration into Shanghanlun, the Yellow Emperor, ancient classics, and in particular the Fire Spirit School. I've been through a few years through the Fire Spirit School, the contemporary one, the more older one. And then the founder of the Fire Spirit School, Zheng Qing'an, he was a Huaishuan student. Huaishuan is a Sichuanese, like Confucian school. But also many of these people did medicine. And then I went into the Huaishuan school in the last 15 years and became a disciple of the Huaishuan school. So the origin of the Fire Spirit comes from the Huaishuan. And the Huaishuan is what I, develop a great liking to. So the whole medicine that I call Hunyuan is what I learned in the Qigong and the Tai Chi side, and in the Shanghanlun fire spirit type medicine, and then also the heart medicine that I learned from the Huaishuan. They all kind of came together for me into one system that over the years made sense, and I started building it in a way that I can teach and make sense to other people, that is very efficacious, works, you can reproduce the results, it's very logical, a lot of common sense. So there's very little, I mean, in the past, there was more vague things, when you deal with traditional learning, especially in the Qing dynasty or before, like 200, 300 years ago or earlier. There's a lot of spirituality, but there's also a lot of things that the logic is not super great. Like you have to believe in a lot of things. Many times medicine in past centuries was kind of in a gray area between religion and science. So, many of the Buddhist monk, Taoist monk, they were all physicians. So the spirituality, religiousness, and science, they all kind of mingled together. But I think that for us in the 20th, 21st centuries, doing a medicine that is spiritual, yet it's very pragmatic, very practical, very efficacious, is the right thing. And it could be very deep and it could be very spiritual, but not spiritual in a way that is obscured, but spiritual in a way that you go deeper into it and say, wow, it's so beautiful. Life is so beautiful. It's not life is so vague. It's just life is so beautiful. So it could get very deep. And in a sense, I'm just sharing with you like the idea of Hunyuan. What is the specific and the details? Of course, there's a lot of them, but this is overarching understanding of Hunyuan is something that is very spiritual, but at the same time very logical, very efficacious, reproducible, teachable, learnable. This is what Hunyuan medicine is.
Thank you so much for that. Did anyone have any questions for Yaron regarding that?
I can go ahead. I mean, you can ask questions, but I can give you a little bit of the understanding, more details, and then maybe you can ask question about that. But go ahead, Mark, and then.
Oh, sure. So mine is just like a very general question. So I think, some of us who will show up for the class, it's brand new. We haven't done anything with you or read anything by you. And maybe some people have read some of the books or things. I just was wondering, do you have any recommendations for like before we walk into your class? Is there something you would recommend or you would like us to read before we come in? So yeah.
Obviously, I mean, there's a lot that I can recommend, but I have a few books that I published. One of them, which is like for beginners, called Hunyuan Foundation. So you can get an ebook or hardcover that kind of gives you an overview about the herbs, the acupuncture, the heart side of medicine, things like that. But it's something that is very readable, and it's for people that never did Hunyuan Foundations. I also have like an online school. Website is hunyuan.life, and there are many, many courses there, about 700 hours of recordings. There is like a basic course called Hunyuan Circle Theory. So that's a course that you can start, give you a total overview of how to understand the theory of Hunyuan medicine. But part of it we'll do in the course. So you don't have to do that online course. That's what we will learn in the seminar. So, but if you want to kind of come prepared and know it already, that will be that online course. But otherwise, we will learn that theory in the seminar.
Okay, and I see Michelle put a link to the Hunyuan Foundation's book. So, okay, thank you very much.